Good afternoon, good evening, good morning, everybody, wherever you're from. I'm Collette Thain. I'm the founder and ex-CEO of the foundation. And with me, we have the wonderful Dr. Robert Gish from the States, who's very happy to answer your questions today. Now, you can do some questions on Facebook, and Linda will fire them through to me. I've got a wee list here, and so I'm going to make a quick start. But just to say to you, sometimes, people have got a lot of information, and doctors really can't give you answers without all of your information and with you being his patient. So keep them pretty general, but being specific to you and your PBC. If there's complications, that's more complicated. We can't ask too much of the doctors to comment. Bob, how are you?
Good morning, good evening. Things are great, or good afternoon.
Are you ready to go then, Bob?
I am ready.
Okay, so our first question we have is, if bloods are doing okay on a lower dose of urso, should the dose be increased to what the chart says for weight, or is a lower dose acceptable in this situation? So the chart, Bob, is what we have. This is the PBC chart, and it tells you it's in imperial and metric. And I would say to that person, stick to the chart. If your bloods are doing well, you don't reduce it. You don't do your PBC is not going away. You stay on the urso for life. Stay at the dose according to the weight, the weight chart. If you don't have one of these, go onto our website and you can download. Bob,
Agreed.
are you okay with that?
Yeah. Totally support you. Full dose.
Okay, good. And long may it last. I've been on it 30 years, so I'm living testament. It works. So your next question is, I've been taking urso for 3 years and I've experienced some nerve pain, numbness in my back. My GP prescribed Prevalin. I think that's American, actually. Do I need to take these medications at different times? If so, how long apart? And can they interact with each other? Bob?
So when we think of drug-drug interactions, of course, we're concerned, and there's some really good websites, I think, including a Liverpool website that you can look up at medication and see if there is a drug-drug interaction. That specific medicine, I've not heard that interacting with urso or any of the new PBC medicines, but I always go to the source. Yeah. And people with pain with PBC, of course, we're concerned about other autoimmune conditions, different types of arthritis. There's something called ankylosing spondylitis that can cause back pain. So if you're having pain symptoms that are not typical for PBC, which is more liver pain, then it's time to see your provider and have that arthritis or that pain worked out. A good physical exam always works. Stretching every day, super important.
Absolutely. I would also say, I don't know what they call them in the States. In this country, the two most underused medical disciplines are pharmacists and physiotherapists. And so any anxiety about your medication, your pharmacists are highly trained people. So don't hesitate to ask them as well. And if they don't know, they know where to find out.
Great comment.
Yeah. So the next one is, I was diagnosed with PBC in September and started urso thereafter, and all my bloods have come back to normal range. Fabulous. However, I can't say I feel great. I have periodic flu symptoms, aches and tiredness. I get a lot of headaches and have developed a slight tremor, which comes and goes, and I'm very pale. My question is, do the symptoms stay even if bloods go back to normal? I've no idea what my liver is like, because I have to wait 49 weeks now until I get a fibro scan, but the ordinary scan showed slightly fatty liver. Should symptoms have improved if I responded to urso and bloods are normal? Bob, if I can make just a lay comment here, I would say to everybody what you really just said. Anybody with any other symptoms of PBC should go and get checked again, because we get other things as well as PBC, and that's really important that you do that. So I'm going to let Bob take over here, because it's a very good question, Bob.
And there's 3 questions built into this that I'm hearing. One is normal liver tests. So let's talk about what's normal. An AST, ALT, alkaline phosphatase, and GGT are the 4 foundations of the liver enzymes. An AST and ALT in females should be less than 25, and in men should be less than 35.
That's American numbers. Ours are different, everybody. They're on our website, just to say.
Okay, yeah, and look at the conversion, because what the lab says is normal, maybe normal, but it's not healthy.
Mm-hmm.
Healthy is different than normal.
Mm-hmm.
Alkaline phosphatase in US and was 115, and GGT should be less than 35. Collette, are they doing GGTs routinely everywhere? Okay, good.
Yeah, we got GTCs done. I had mine done the other day. Yeah,
it's an under-respected lab test.
I agree. There's also an over-assumption with GGT that if it's raised, it's alcohol-related, which is...
Yes. I look at the GGT alk-phos ratio. If the GGT is a lot higher than the alk-phos, then I do a blood test called PEth, P-E-T-H. Everybody should be aware of PEth testing. It tells you how much alcohol somebody's been exposed to over the last month. It's actually quite useful because we do have overlap in PBC between fatty liver. Sounds like this individual might have fatty liver. Fatty liver has been, I see, in 25% of my PBC patients. And then, of course, people with PBC, in my opinion, shouldn't drink alcohol. I'm a zero-sum person, knowing people might have one at a wedding. So think about that for a moment. And back to the general symptoms that might be there. I don't think URSO really helps general symptoms very much. That might be PBC related or autoimmune. But like we said at the beginning, go to your provider, get a good physical exam, really go over those symptoms, look for other causes.
Yeah, absolutely. And I would also say too, I'm going to bring in some diet here. I think one of the worst substances known to man, whether you've got PBC or not, is sugar. And I've taken quite a number of helpline calls this morning. I've asked people how much water they drink, because in various parts of this country, we have fabulous tap water we can drink. If not, you buy it. But you're looking 2 to 3 litres a day. And I don't mean juice, and I don't mean coffee, and I don't mean tea. I mean water, plain water, because many of us walk around dehydrated. If you feel thirsty, you're dehydrated. You need a bit to drink to get you back on track. And also the amount of sugar that you take into your body as well. Sugar's toxic for everybody, let alone people with PBC. And there's many hidden sugars and things. So, I mean, I do think whoever sent this question in, given that the chairman also should go back to the doctor, but I would also just make a note of sometimes our symptoms can be not so good diet and dehydration. And I know we get tired, but, you know, we've got this mantra of movement is medicine, you know, walking around the block, going with a neighbour with a wee dog, it really does help fatigue. If you lie down to it, it'll just make it worse. But I do agree with you, Bob. People should always, with new symptoms, get checked out.
I want to comment on that too, Collette, that it's when people have PBC, and itching's part of it, but they have what I call a sleep disorder. And when you're not sleeping well, your body has even worse challenges with inflammation. So sleep is anti-inflammatory, and a vegetarian diet is anti-inflammatory. So things to think about. And Collette, are you asking every provider to discuss with their patients and vice versa about getting worked up for sprue and everybody with PBC?
With sprue?
Celiac disease.
Oh, right. Okay. No, if people have symptoms, I do suggest that they mention it, you know, to their providers, their doctors.
My protocol, everybody gets a sprue, a celiac panel, blood test, very simple blood test.
Right. Okay. Is that a blood test now? In the old days, it was tubes and things. I remember. Okay. There you go. Celiac. And celiac is really, it's gluten. You want to be eating gluten-free food, but don't do it unless you're being diagnosed. Diagnosed in 2022, but not taking. Now, this is an interesting one, Bob. Not taking URSO because my liver numbers are normal. Being tested once a year by the liver specialist. My only symptoms are fatigue and anxiety, which cause me not to sleep well. There we go. And adds to my fatigue. Of course it does. Any advice on what I can do to decrease my anxiety, sleep better at night? There's lots of things you can do for anxiety. Exercise is one of them, and it doesn't have to be going to a gym. As I say, walking. But you can also, there's lots of apps these days, you know, that play lovely music and teach you self-relaxation techniques. You can do it on television, breathing, slowing your heart rate down. What do you think, Bob? And I'm quite interested. Their liver function's normal, but no urso. Can you comment on that first, please?
Let's do terminology, Collette. I need you to help me get rid of this term LFTs or liver function when
So
we're talking
liver
about
enzymes. Okay.
super important. And my patients have taught me that because they get very anxious when people use the word function. It means they think they're not functioning well.
Of course.
The provider's not telling me something. I'm in liver failure. I need a transplant. No, your function's normal.
We're enzymes. Okay.
Really. But this sleep issue, healthy sleeping can change your life. And people need to be very cautious about caffeine intake. They should not be drinking caffeine after noon. If you're really sensitive to caffeine like me, I can have 1/3 of a cup a day of caffeinated coffee. That's the max my body will handle. So be very cautious about caffeine. And sleep habits are super important. Meditating, using sound. There's some really powerful breathing techniques to help put somebody to sleep. Mm-hmm. So let's keep that in front and center.
Mm-hmm. Yeah, no, you raise good points there. I hear a lot of people that have sleep disturbances, but I don't know if it's in the general population. I know during the menopause it is a bit of a nightmare with sweats, but you can get cool pillows and all sorts of things that weren't available for our parents' generation. But come back to us if you like, and I hope you find that helpful. Diagnosed with PBC in 2005, and she's now 78 years of age. And she's responded to Ursodol medication. So we're now over the pond to you. In June 23, my FibroScan score was 6, now increased dramatically to 13 in November last year. In May, I finally weaned off prednisolone, having taken it for a number of years for polymyalgia flare-ups. Should I be concerned with such a considerable increase? I have no undue symptoms, and is there anything I can do to help myself?
Yes, so getting a fibrosis scan every year, and there's 9 different companies that make this. So I don't use the word fibroscan anymore. I'm using the word elastography. So yes, that's a very good, important test to have done, and a big change in the KPA or liver stiffness is a major concern. But we need to make sure that somebody was fasting when they have their fibroscan or their elastography. You should be fasting for at least 4 hours, preferably 12. That makes the test more accurate. Super important. Also, evaluation for fatty liver. I look at that liver stiffness, and I look at what's called the CAP score or the attenuation score. And that tells you what's going on with how much fat is in the liver. Remember that the goal of this treatment is to have the alkaline phosph and GGT normal. And every year, your provider and your individual with PBC should be discussing second-line therapy. Not everybody responds to URSO. People progress on URSO. It's a very significant number of people. Now we have 3 choices for second-line therapy, and we have medicines that are off-label, which I rarely use because they're off-label. So we have to think about this, and it was the change in liver stiffness that people need to monitor. Collette, that was the subject.
Okay. Sorry, this is the joys of working from home. A delivery, and it wasn't even for me. Right, we've got something come in live on the email. Can I take omeprazole, which is, omeprazole, you know what omeprazole is, Bob? With URSO, if I should take it, or should I take it at a different time? Same as supplements like magnesium, vitamin D3, fish oil, and multivitamins. I would say, first of all, taking vitamin D is absolutely essential for those of us in the Northern Hemisphere at a certain age. Absolutely essential. So should she take them at different times? Can she take omeprazole with her URSO, or should it be at a different time?
As far as I know, there's no interaction at any time between omeprazole and URSO. Omeprazole lowers acid production in the stomach, increases pH, but URSO is not pH or acid dependent.
Yeah.
And I think you can take all these at the same time. I'm not hearing any significant drug-drug interactions. I think that's safe.
And take your URSO all at once. You don't need to spread it out through the day. It's quite a burden, and it gets it out the road, and you can move on. Right. Okay. I've been given I don't know what this is, Bob. I've been given a spiolto Respimat inhaler. Is this safe to use with my PBC?
I don't know that inhaler specifically, but I don't think there's any interaction between the disease and URSO. So I think that's safe.
Yeah, I think you've got to probably accept the fact that when your doctor's prescribing something for you, he does look at your other medication. But again, why not go to your pharmacist and have a look and have a word with them and see what they say about that. And URSO itself is quite a safe drug, isn't it? I mean, there's very few side effects, and what there are, normally they fade away, don't they?
Collette, let's remind people that URSO is made in our human body every day. We are giving people a booster of something that's natural and normal. It's anti-inflammatory. It's so natural that it has very few drug-drug interactions. And in fact, the main thing is don't take these anti-itch medicines, the bile acid binding resins like cholestyramine or cholecipol with the URSO. So take the URSO in the morning and you can take your anti-itch binder, bile acid binders, and later in the day. What do you think?
Yeah, no, absolutely. Just keep them well apart. Some of the anti-itch thing it's like wallpaper paste. It's not very pleasant, but things do stick to it. Got something on the screen here. I've been diagnosed with breast cancer, had a lumpectomy this month and waiting on the results. Any link PBC or so with cancer. Can I just say to you, many years ago when I was first diagnosed, there was a huge study in this country about is breast cancer connected to PBC, and no,
it's not. I agree.
No.
So I should shake my head. No, not connected.
No. So, Bob, the next question is URSO, well, given it's a bile salt.
I would say these bile salts, these anti-inflammatory bile salts, theoretically would have more of an anti-cancer effect, not a pro-cancer effect. But we know the bad bile acids can cause fibrosis, scar tissue, and that can lead to cancer. So URSO, I'm going to say anti-inflammatory. It's a really good bile acid.
Yeah, I think we're very lucky that we've got something like URSO to take that, it's got some benefits to it. But Jane, look, we wish you lots and lots of luck and come back to us if we can help in any way. But I'm fingers crossed for you. I'm sure it'll be okay. I'm sure it will. Right. To have to pronounce these things. Is maybe bad for the liver? Is it safe to take with PBC?
I didn't hear the name, Collette.
EZETIMIBE. I've seen it before.
Is that right? That's a diabetes drug. And
is it? Right, okay.
There's not an association with causing PBC or making PBC worse, and doesn't interact with URSO. And
is it safe to take with PBC?
I think so.
Okay, yeah, I thought so too. But again, check. I recently had an endoscopy which showed grade 1 lower esophagus varices collapsed on inflation. I'm worried about starting carvedilol as I have low blood pressure. It also showed mild erosive gastritis and erosive duodenitis.
Duodenitis?
I was an accountant, not a doctor. They said the doctor would call if the biopsy showed bacterial causation and antibiotic would be prescribed. This has not happened, so I assume it's not bacterial, so don't know what to think or do. Is this common with the PBC or totally unrelated?
Well, that's a very complicated individual question.
Yeah, it is really.
But I do want to bring up, this helps us with this general comment that anybody with duodenitis has to get worked up for sprue with a blood test and maybe a biopsy of the small bowel. Biopsy ultimately is the way to stage celiac or sprue. So I think that's important. A lot of these other interactions with PBC aren't completely clear. It's very individualized. So I would take these conversations back to the provider and see about that, answering individual.
Yeah, this is again, it's very difficult to comment, and I hope you find that helpful. But I don't often read things of this nature to do with PBC, thankfully. But let us know how you get on. But don't ever be afraid to ask your consultant a question. And take somebody with you if you feel you're not going to remember, you don't understand, and take a wee notebook and a pen. It's fine. It's okay. This is your life, your condition. So don't worry about it. Can you tell us a bit about Sjogren's with the treatment options are, please? Now, if I can just make a comment about Sjogren's. Sjogren's, I'm assuming that your eyes and your ears are affected. I will say this to you, and I'll hand over to Bob. First of all, if you're using eye drops, make sure they're oil-based and put them in 6 to 8 times a day. Put them in as often as you need them. You know, don't put them in once in the morning, expect your eyes just to all of a sudden be moist, because you've got 2 sets of tears, you've lost one set that would become active when you blink and they keep your eye clean. They're not there anymore. You can cry, you shed tears in the wind, but these tears aren't there. So keep them topped up, keep your ocular surface clean. It's really important. And as for Sjogren's in the mouth, there's lots of things you can get, but I'll say this: do not use chemical mouthwashes. Please do not use chemical mouthwashes. They change the taste of things in the mouth, they stain your teeth, and there's a potential they will make your mouth drier. Please do not use them. Ask your dentist for something fitting for Sjogren's. Bob, over to you.
So this also relates to a question somebody had earlier, and you were talking about drinking lots of water. Yeah. People who have Sjogren's have SICA, S-I-C-C-A syndrome, and they can have a dry mouth and then drink way too much water. So be, reasonable in that mid to high zone for water consumption. But dental care is super important. I tell my patients every day 5 steps, which is brush, floss, use some type of mouth rinse.
Salt water, my granny said.
Water, yeah. Salt water.
Salt water.
Salt water. It's good. Scraping the tongue is super important, and using a water pick, using a water irrigation really cleans the mouth, cleans the teeth. Yeah. If you've got bad breath, you're not taking good care of your mouth. So, and the biome starts in the mouth. If you have a healthy mouth, that really leads to a much healthier intestinal tract. These are really important concepts for everybody, including PBC patients.
Yeah. Okay. Next one. Thank you, Bob. I've been put on statins by my GP to bring down the cholesterol, but according to the leaflet, anyone with or ever had a liver disease should not take them. This is lawyers' belt and braces, or attorneys, you should call them. I saw the consultant who said there was nothing wrong with my cholesterol, as I had side effects, which I believe 1 in 10 do have. So the GP decided he did not want me to take cholesterol. My blood pressure is superb and low. So if your GP doesn't want you to take cholesterol tablets, fair enough. I think the jury's out on these these statins, don't you think, Bob?
I use statins in all of my liver patients. 100%. I discuss these. I want to bring the LDL cholesterol down to around 70. I think they're extremely safe. The risk of liver injury from any of the statins is 1 in 80,000 people. You did mention side effects, which is muscle cramps. And my experience is it's 3 per 100. But if you take these statins and you have muscle cramps, you should stop. I'm in the statin world. There are other people that are anti-statins, but I think there's incredible evidence in liver patients that you live longer, you have less cancer, you have decreased what's called portal hypertension. There's an anti-inflammatory response from the statins, and I use them 3 cups of coffee and 20 milligrams of atorvastatin in the mornings, what I recommend to all my patients. Coffee is incredibly important too.
Yeah, well, I've got an acidic stomach. I can manage half a cup and then it's decaf. This is a wee question here. Is it true that excess bile salts can cause the itch? So does that mean you're taking too much urso?
The urso, we mentioned before that urso has side effects. 3 to 4% of people can't take urso. And one group of that is urso makes the itch worse. So we have 3 families of chemicals that cause itch. One is bile acids. We know that. That's why bile acid binding resins work in some people. Number 2 is something called lysophosphatidic acid. This was discovered in Holland, really nice study. I think that's about a third. And those people, I use primrose oil. Primrose oil is over the counter. It has a really nice anti-itch and anti-inflammatory effect. So primrose oil, Collette, if you haven't heard about it,
No.
move that to the top of your itch list.
Okay, primrose oil to put on the skin or to
2
inject?
grams. Don't break open the capsules and spread it on your skin. Just take it by
Swallow,
mouth.
right.
2 grams twice a day, swallow. And I had just amazing testimonials from my patients how it works. Not in everybody.
Yeah.
So nothing works in everybody. You have to customize this. The third thing we just discovered is something called IL-31, interleukin 31. And it looks like about a third of people, the IL-31 is causing the itch. And the new medications like Solaldopar actually decrease IL-31. And we think that's how it decreases itch. So is Solaldopar and elafibranor available in Europe?
Do you know, funny, I had a phone call about that this morning. Robert's in London. I need an update on that, but they're well on their way. Solaldopar is the other one. I'm sure is not far behind it. But I'll get Robert to post something.
Excellent.
The other thing I want to say about the itch again, you hear wee anecdotes from people. And there's one of our ladies, very, 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 very bad itch, and she gave up chocolate and everything else, and her itch went away. Christmas came along, she thought she'd have a little treat or some chocolate, and her itch came back. Now, I'm not saying chocolate causes the itch. All I'm saying is the itch is dreadful. And if you find something that you think is making it worse, don't take it. Don't take it. But think about chocolate. And again, going back to sugar, which I truly, truly think is an unhealthy thing for us all to take. But yeah, primrose oil, whoever's in the background, Jacqueline, could take a note of that and put that on the itch list, please. That would be wonderful. Thank you. We've got another question just on the back of that. Can PBC cause high cholesterol? This person's last test was 8.2 and it's never been that high before. But of course, it's the higher and the lower density. You need to get that broken down, I would suggest.
But remember, there is a very clear syndrome, what do we call it, where people with PBC could have cholesterols as high as 1,500 milligrams.
Or 40 in this country, yeah.
Sky high. And it is the PBC.
Yeah.
It's a type of cholesterol that causes problems, but usually not heart problems.
Mm-hmm.
It can get into the nerves and the skin and other places.
Mm-hmm.
So, and that cholesterol is bad because there's too much, but you should talk to your provider about heart disease risk. And that's back to what you said, the panel, what's the LDL? And what are other scores that you might have? Family history, hypertension, diabetes. There's a lot of things that interact.
Yeah. Take that too. You want to speak to a liver specialist and not your GP, because GPs don't have that in-depth knowledge, and that's fair enough. And we're back on Shogun's. I've had dry burning eyes, dry mouth all the time, and taken Benadryl, which I don't know the right way to treat. Is Benadryl the right way to treat it? Maybe just at night so as I can sleep. Well, again, you maybe heard what we said earlier. Is there anything you could? Do you know what Benadryl is?
It's an antihistamine that can cause dry eyes and dry mouth. And I personally can't even take Benadryl because I hallucinate on it. So it's got a lot of side effects. There's other medicines for sleep. One thing I wanted to bring up is this medicine called Trazodone. It's a very old medicine. It's been around for 40 or 50 years. Originally came out as an antidepressant, but it's very weak for depression. So that's not the use, but it's great for sleep, and it really improves REM sleep. So it improves the sleep dream cycle, and that's healthy. REM sleep is good for you. Dreaming is good for you. So Trazodone needs to be considered alongside melatonin, which is also natural.
Okay. The next question is a link between PBC and breast cancer, and we've said no, so we've answered that twice. Here's an interesting one for you, Bob. I've got restless legs that are driving me nuts. What can I do?
Ooh, that's another family of conditions that can be related to autoimmune diseases. So it could be a side effect of the PBC. It's a neurologic movement disorder. And there are a number of medicines that can be used specifically for restless leg. So that's, again, a provider question. I can give you a list of potential medications for restless leg, but you need the person, whoever has restless leg, needs to be worked up for sleep apnea, for depression, for metabolic issues. So restless leg, that's a whole workup, and go to your provider.
Yeah, you need to get more information on that about what they can provide to help you. There must, as you're saying, there are things there. Celia's asking, are calcium supplements bad for you?
We recommend every person take 1,200 milligrams of calcium per day, and it should be in the form of milk or milk products or tablets, but the tablets should have calcium, magnesium, and zinc. This combination improves calcium intake. I did see in the Q&A that somebody had high calcium in their blood. This is a very rare condition. And of course, if you have a high calcium, you need a full workup and stop calcium supplements until there's fully evaluated. Every year I have people coming to me with a high alkaline phosphatase. People think they have PBC, their AMA is negative, their GGT is normal. And I work them up, and they have something called hyperparathyroidism. The parathyroid sits next to the thyroid and regulates calcium. So anybody with a high calcium needs to have a parathyroid workup. But back to the question, 1,200 milligrams of calcium a day is healthy. Right.
Okay. I'd rather take mine in my yogurt and my milk products, but anyway.
Nice.
Yeah. Yogurt, Greek yogurt, and raw porridge with cinnamon, some walnuts, flaked almonds, and yogurt. That's breakfast. Raw porridge is so good, and that reduces your cholesterol as well. Porridge.
Like it. Nice.
Okay. It's a Scottish thing, Bob.
Oh, we have pea porridge hot, pea porridge cold.
Yeah, I have it cold. Yeah. I've got good cholesterol. Okay, I've had PBC since 1998. However, I've just started to suffer from heartburn. Lucky you've gone all that time. Is this a consequence of PBC? Maybe not, but go on, Bob.
Heartburn is just acid sensitivity. One of the most common causes is people are overweight, and that can cause heartburn and acid reflux also. So that needs to be worked up, but I don't have a direct connection with PBC. I think that's a separate discussion. But people with PBC can have a rare form of another autoimmune disease called atrophic gastritis, and they can be B12 deficient. So if you're anemic, you get an iron workup, and you should have a B12 and folic acid workup. Very simple blood test, and you can then look to supplements if deficient.
Mm-hmm. I know an awful lot of people who do get stomach acid. I certainly do, and I eat very healthily. But I think my belief, and I'm not a medic, is that I hear an awful lot from people with PBC, and I don't know. Maybe it's the water over here. I don't know. But I know an awful lot of people taking antacids. Okay, apologies if this has been asked, but has elafibranor been released yet? I don't think it has, is it? I've been taking Urso, but not fully responsive. I'm waiting for the above medication. Thank you.
Yeah, elafibranor is approved in the US and pending in the EU right now, I think, with Solaldopar. And what's interesting is this very broad use in Europe of bezafibrate. But bezafibrate has not been approved by the regulatory authorities for PBC. People use it because there's some data that's supportive, but no phase 3, no randomized trials like we use to really prove a medicine works. Mm-hmm. So I really encourage patients and providers use on-label medications first. Mm-hmm. And if people still progress, then think about third line. But bezafibrate, fenofibrate are third line, not second line, not first line.
Yeah. Okay. Can acute stress cause liver enzymes to spike? That's a good question. Acute stress. And my goodness, the last 18 months of my life have been the most stressful in all my life. My youngest son taking a heart attack, and also my husband getting very seriously ill, losing my best friend, one of the foundation's founders, my dog, just stress, unbelievable stress. and you really, really have to work hard to find ways through it. And medically, I don't want to take tablets. I don't want antidepressants. I'm not depressed. I'm just stressed, and I've had a lot to deal with. It has not affected my liver enzymes. Touch wood, I'm pleased about. But we all have to deal with really high levels of stress at times in our life, and a parent dies or whatever, those accidents happen, and we have to find ways through it. But I'd be interested on your response to this, Bob. Can they cause she's saying acute stress?
Directly, no. But when people are stressed, they can go back to a very poor diet. That can raise liver enzymes through fatty liver.
Poor sleep.
Alcohol.
Poor sleep.
Per sleep, sorry?
Well, because people who are stressed, they don't sleep so well.
Right. But it's behavior like food or alcohol that can really drive that can really drive liver change. Directly, stress is not going to change liver enzymes, in my opinion.
Yeah. But if you are struggling, then do give us a ring at the office, and they'll put you through to me, or I can ring you back and can have a chat about it. We're all in this together, and we're human beings with PBC, and life goes on around us. But we are in a position where we can help and support each other. So don't ever hesitate. And I do take calls out with office hours and weekends as well. So do bear that in mind.
Your great service, Collette.
It's my life. It's my life. It's my joy. And I mean that sincerely. Do you know, I'm going to tell them all because we've got time. So I met Bob, we think 10 years ago, and Bob was coming over from the States, and we were to do this 5-mile walk with my dog. My dog had very little Queen Anne legs. She was a Corgi cross. Anyway, Bob's flight was delayed. Robert contacted me. He said, I don't think he's going to get here. And I said, okay. So I set off on my walk up hill and dale, you know what Scotland's like, and came back. And just as I got back to the car park, there was Robert and Bob that arrived. And I said, well, I can't do that again. Bob says, why not? And he said, well, I said, because I've got PBC and my dog's tired. She's got little legs. He said, look, if your dog's tired, I'll carry her. You've got PBC. I'm a doctor. I'll look after you. Come on, we're going. So off we went. And there's this wonderful photograph I'll put up, if you like, of Bob carrying my dog. I was fine.
Glad to be there with you.
It was a lovely morning, but it taught me something, Bob, because I pushed my own boundaries. I never thought for a second I could have done that. And I did. And thank you. It taught me a lot, and I passed it on. Okay, right. Oh, here's a good one. So we've had a couple of questions related to TUDCA, which is tauroursodeoxycholic acid, which is different from UDCA, which is urso. Can these two be taken together, and is there any benefit from taking both? Now, I'd never heard of this, and Robert phoned me from London today, and he was telling me tauroursodeoxycholic acid is a supplement. So, Bob, over to you.
We have very little information about this supplement or this bile acid in PBC. I haven't heard of any information that it's dangerous, but we just should wait for more information before taking additional supplements. I think that's an important message.
Yeah, and you will be hard pushed to get a medical doctor to comment on supplements when they haven't been tried and tested. Doctors stick to their research, I can assure you. And why not? I've taken DOPA response dystonia for 40 plus years and just been diagnosed with PBC. Could this be linked?
DOPA sodium. I don't know what that is.
No, DOPA responsive dystonia. I had DOPA responsive dystonia.
Oh, so dystonia. Okay, so it's probably dopamine responsive, but no link to PBC. Great question.
Okay, right. Can beginning a strenuous weightlifting program cause the enzymes to spike?
Yes, you're talking about liver enzymes, and AST is very much derived from muscle. Mm-hmm. So I've seen enzymes over 1,000 from somebody being in the gym for 2 hours and doing heavy weightlifting. ALT can also go up, but muscle weightlifting exercise won't cause the alkaline phosphatase or GGT to rise. So AST and ALT can come from muscle, bottom line.
So, okay to continue. Exercise is
Yeah.
good, isn't it?
Don't check your blood tests until you've stopped exercise for 3 days.
Okay,
3 days, that's
will
the
do.
rule.
Right, this is a brilliant question that's coming in. Thank you, Linda. Linda's firing them off to me here. Are sweeteners okay to take? So you're talking saccharin, artificial sugar. A big no-no from me. Do you want to explain?
No.
Do you want to give a wee explanation?
Well, we know these synthetic sugar substitutes have been linked to all sorts of bad outcomes. Bladder cancer is one I think of immediately. No reason to go unnatural. And if you're going to take in sugar, I use agave syrup in my house or honey, but in low doses. Table sugar, I think, is part of the conspiracy. It's like you said, one of the poisons out there. So don't use artificial sweeteners, simple sugars at very low dose. That's the final message.
Very, very low dose, or cut them out from me, okay? Right. So they say, which statin do you advise? That's I don't know. Can you answer that?
Well, there's a family of them. There's actually 7 different statins. The 2 that I think have the most potency and still low risk of side effects are atorvastatin and rosuvastatin. Some of the older ones, pravastatin and simvastatin, are quite weak. And some of the other ones I just don't have experience with. But atorvastatin and rosuvastatin, extremely safe, causing liver problems, severe liver problems, 1 in 80,000 people. That's from the literature. And at 20 milligrams a day, they're quite safe. And you really want to focus on getting the cholesterol down, and the LDL cholesterol should be around 70. That's US units, of course.
Okay. Yeah, which you can have changed into British. Can the brain fog from PBC cause serious mental issues, recognition, information retention, and ability to problem solve, or even navigation of driving regular routes?
I've heard all of these symptoms from my PBC patients. So there is this inflammatory state. The inflammation goes to the brain, and the brain is like a sports car. It wants the best fuel, the best suspension, the best tires. In this inflammatory, but I haven't seen a link to permanent brain injury. I haven't seen a link to something like Alzheimer's or any progressive dementia. But it affects quality of life in people every day. And go back to the sleep, exercise, sleep, healthy diet. That brain fog hopefully would get better.
Yeah. But I would also say to this person, go and see your doctor if this continues. When I say your doctor, I mean your hepatologist who's looking after your PBC. There could be other things going on. And again, exercise and diet is important, because a bad diet will bring on these symptoms too.
Yeah, bad diet is terrible. The inflammatory diet is something like red meat. So minimize red meat, no processed food.
It's processed food. A lot of parents, mums, dads go out to work, got the kids, picking up from school, rushing, buying ready-made or what have you. It's all right for me. My kids have grown up, they're old men now, but, it's tough for young parents. But just be mindful, maybe a bit batch cooking at the weekend, homemade soups, things that you can see the ingredients, you're buying them fresh. Just have a wee think about it. And again, if you want to chat about it, just give me a ring, because I can cook up, a meal for 12 quite quickly and section it and freeze it, and it's all very healthy with nothing added. So do give me a ring if you want some chat on that. How can I get out of this fatigue and no energy? Well, before you say anything, Bob, I'm going to say 3 things to this person. What's your intake of fluid, your water? What's your diet like, and how much exercise are you taking? I don't mean going to the gym. I mean getting up, walking around the block. If you're too tired, walk from one lamppost to the next and increase it the next day. Go to your garden gate, walk up some stairs and walk down. but increase your exercises. You will buy into more energy. It's been scientifically proven. They put me on the bikes and they wired me up. It's been proven. And they've done it to quite a number of people. What, you got comment there, Bob?
I think this whole issue about fatigue, brain fog interacts with itching, interacts with sleep, could cause a depression. And then you have this down cycle that takes place. Each thing is moving on each other to make each of the other symptoms worse. So positive energy, treating depression is very important. And we have good antidepressants. I don't want to necessarily just throw more medicines at people. But if you have severe depression, that needs to be managed through your provider also. So think about health from a sleep perspective, a diet perspective, exercise perspective. Stretching is just part of exercise.
Mm-hmm.
But trying to stretch up to an hour a day really has an anti-inflammatory effect on your body. It's this whole package of good health.
Mm-hmm. And also, don't hesitate to go back and get more blood tests in. There could be a thyroid thing going on. You could be anemic. You could be a number of other things. So any change that doesn't change back, go and have it looked at, I would suggest to you. Okay, great. They're coming in fast and furious. We're going to make it fast. So I'm taking bezafibrate, 400 milligram tablets with 3 or so, 750 milligrams, fine. Can I ask to come off this? What would you suggest? I'm a healthy, fit person. Cholesterol's high, 8.2, but I feel great and eat healthy. So you're taking your Urso. You've been put on bezafibrate, but we don't know why, because bezafibrates are a second-line medication for PBC. Some doctors give them out, and it works for some patients. But bezafibrates are for another condition as well. So I don't know, Bob. What do you think?
Well, bezafibrate was originally designed to lower cholesterol and triglycerides. That's why they came on the market. And this was an accident about using it for PBC. And I really want to enforce these drugs as third line. So we have Urso first line, Oca, elafibranor, Seladelpar. We'll call it Ella-Cella. Those are second line.
Yeah.
Fibrates are third line, off-label, and there's a lot of toxicity from fibrates. So you have to be monitored for muscle injury, kidneys.
Liver.
Yeah. They can cause liver tests to go up. So the fibrates can be liver toxic also. So we have to keep all these in mind. And then, of course, if it's for cholesterol and PBC, it's going to be helpful potentially. But go back and look and talk to your provider about approved therapies for PBC. Yeah.
But I was also, they're asking about the cholesterol. You're saying it's 8.2, but you need to find out what's your higher and what's your lower, because for PBC, it is different. So if you find that out, maybe come back to us.
Right.
Can you advise Primrosol dose? And the dose you did say, actually, I wrote it down. You said 2 grams morning, 2 grams in the evening.
Correct.
Is that right? Okay,
perfect.
There you go. Stevia as a natural sweetener, is that okay?
No.
There you go.
I don't call stevia natural.
No.
It's naturally made in a factory.
Isn't it interesting how the manufacturers just slap this word natural, or from natural sources? Define natural.
A human being made it. That doesn't make it natural.
No. This lady has posted the following: side effects of new medication causes liver and bone damage. I don't know what that's meant to mean.
Okay, so Seladelpar and elafibranor in the package insert, the package information, discuss elevated liver enzymes on these medicines. Same thing with bezafibrate, same thing with fenofibrate, same thing with Oca, and even Urso can cause a bump in liver enzymes. So monitor your liver tests if you go on these new medications. I usually now check at 1 month and 3 months when they go on. The bone issue was seen in about 3%, 3 out of 100 people. And this was seen at a higher rate in elafibranor treated versus placebo. But there was extremely bad control in the studies on who had bone disease and who didn't. So let's just talk about bone health in general. That's really the point here. every person with PBC should be getting a DEXA scan, which is a bone density study, at least every 3 years. Calcium, magnesium, vitamin D for bone health, extremely important. So don't worry about the side effects of these new medicines specifically about this. It's not a reason not to take them. It's a reason to take them and be monitored. But focus on bone health, calcium, magnesium, zinc, vitamin D3. The level should be between 40 and 50. Again, that's US units. I'm not sure what you use, but it's a little bit higher than what the lab tells you is good. And exercise, very important for bone health also.
Yeah. Yeah. And that swimming, not so much, but walking and even if you're sitting watching the television, lift your body up the arms of your chair. You do all sorts of things, tins of beans. Now, I don't know if we can answer this question. I had a liver biopsy in the NHS a week ago. I don't know why you're having a liver biopsy, but they're very rare these days. How long roughly until my specialist will get the results? I don't know how long results take for biopsies.
Could be 2 weeks. Yeah.
Okay, but could be 2 weeks. Okay.
Hey, Collette, let's talk about biopsy and PBC because I am biopsying more patients now than before because many of my patients have metabolic syndrome. They're obese, they have diabetes, their CAP score, when we do this elastography test, the FibroScan, it shows a lot of fat in the liver. And I go, well, is it PBC? Or is it fat? Or is it both? What's dominant? And I only can figure that out with a biopsy. So that is a reason to consider a biopsy.
On the other hand, they are a serious invasion. I can't comment on that, but what I can say, and I keep saying to people, I'm not a doctor, is that these days biopsies should not be used for diagnosing PBC. And that's what has been happening in this country and other countries. So if it's for diagnosis for PBC alone, then that is not regular procedure anymore.
Yes. Maybe can I comment just a little bit more, Collette?
Yeah.
So if a patient is suspected to have PBC and their AMA is negative, anti-mitochondrial antibodies negative, that makes the provider think of a biopsy.
Well, absolutely. But if it's positive with raised alkaline phosphatase, then that's a diagnosis. And that happens in a large percentage of the time. If there's variation there, as you're saying, an AMA negative, then that's a completely different scenario.
But I want to emphasize, Collette, that we have newer blood tests that may also take the biopsy out of the equation. It's called GP210 and SP100.
Oh, yeah, of course.
These are antibodies. They're anti-nuclear antibodies, but they're available through labs. And if those are positive, that's PBC. Again, no biopsy. So really, the provider and the patient really have to discuss this biopsy. Is it really needed?
Yeah, absolutely. I'm to understand, I only found out 2 years ago that I was the first person in the UK to be diagnosed with PBC without a biopsy.
Good provider.
I saw him, he's 85 now. I saw him the other day. He's going to take me for a coffee. And she's saying, would the NHS app, apparently there's an NHS app, she can see her blood and scan results. Would they put the biopsy results on the app? I don't know. I'm sorry, I can't answer that question. Maybe somebody in the background in the office could ask one of our medical advisors, one of the British people. But I'm sorry, I don't know. But once we find out, we'll put it out there so as everybody can know. Okay, they have put me on losartan. Is that okay? Losartan.
Losartan is a great blood pressure medicine. I think it's in the family, what we call ARBs, A-R-B, and it's very effective and very safe. So yes, treat blood pressure if you have high blood pressure, low salt, lose weight, but manage the blood pressure to protect the kidneys.
Well, we've done it, Bob. We've got through them all. They've been coming in live. They have been shooting down the airwaves. Fantastic. Well done.